Thank you. St. Patrick's Day.
Now we're live, and this is Senate Health and Welfare. We're back. And we're hearing some testimony on S-215. So Miranda Gray and Leslie Visser are here. Did you want to talk together? Good.
That would be fun.
Why don't you bring your chairs up and be great to hear. Yes, we've heard different things about the bill and their interest in the restaurant program. We did hear testimony earlier that it was difficult, I think, to start up, but we'll just listen to what you have to say. We did hear some testimony a couple days ago about high costs associated with people going up to the modest level. But you have to help us out here.
Thank you so much for the opportunity, Madam Chair. For the record, Miranda Gray, Deputy Commissioner of the Economic Services Division. Leslie Wisdom, the Food and Nutrition Program. And I thought I would just start with, I know we were in to testify on this bill that had really focused on the meal program aspect earlier, and regardless, our written testimony just arrived last week, so that is up on your website now. There was just a miscommunication, so that there in writing, but we are happy to go over the Three Squares benefit and where there are limitations, and then also the impact would be to add general fund to that. So I'm going to turn it over to our expert here.
Okay, so you're talking about section 2 of the bill. So the SNAP program is federally funded. All the benefits are 100% federally funded. And every state administers the program in partnership with the federal government. The federal government sets the maximum food benefit per household size based on some statistical data called the Thrifty Food Plan. And that is a complex analysis of nutrient dense foods and the cost and a low budget cost of those foods. Federal government also publishes other food plans, the Moderate Food Plan and 2 others. And those are also just based on slightly higher budget amounts. They just increase for each plan. The SNAP program, Food Squares Vermont, is by law based on the Thrifty Food Plan. The federal government uses those other food plans for things like courts, like bankruptcy or divorce cases, to figure out monthly budgets. They use it for the military. They use it for all different sorts of things. But the Thrifty Food Plan is the basis of the federally funded SNAP benefit. If a state wanted to supplement the federally calculated food benefit, it would be at solely state expense. So that calculation would happen and it would be totally general funds. The proposal in this bill, I can't give you a dollar amount of what that would cost because it's quite complex. I can tell you right now though that Vermont receives almost between 12 and a little over $13 million per month in food benefits for Three Squares Vermont recipients. Annually, if you multiply that times 12, it's almost $160 million. So supplementing that would be some percentage of that amount. It would be likely millions of dollars just for the benefits. There would also be significant IT programming that would change the way our system works. There would be many administrative changes.
Do we have your testimony on here or you? No,
For that piece, no, but I'm happy to follow up.
that would be good. Yeah.
I don't see your testimony at all.
It's under the bill.
Is it on today's? It's not.
It's not under today's, it's under January 30th.
Okay, one of you, why, have you taken it over yet? Okay. Go ahead. Kurt, wait, hold on, I'm sorry.
Okay.
Oh,
No,
sorry,
it's
I'm
okay.
sorry. Go ahead.
Just in general, do you support this bill or not?
I think I guess I'll just go with no, because I think there are costs that we don't understand, because I think, as Leslie mentioned, there are those costs and then there's administrative costs. So the cost allocation across our staff also happens at the 100% federally funded. So then we have to add in that general fund component, how much this grows our program would also, potentially have implications on what staffing needs we would then have. And that is not just for our program, but that becomes our business office would then need to be doing tracking about the general fund component versus the federal, because we have a lot of federal reports that are due. So there's a ripple effect to this that without fully understanding that, I can't come in and say that I support this. And I think as in terms of the meals component, I think that we already have a solution that we are affording people to be able to use the food benefits. To be able
Thank you.
to.
Commissioner, the bill actually for the next meals plan is just asking you to come back and report to us on what it would cost and what the technical and staffing implications would be. So I hear you about all the complications, but what the bill is just asking you to tell us what those are in more detail. And to tell us what the unknowns are right now. So I find it odd that you would oppose trying to find out the information about what it would cost and how it could be implemented.
And I will, oh, I'm sorry, no. I think that section, the language in that section of the bill might be a little bit confusing, so it's section 4, sorry, I misspoke earlier. It's labeled transition plan rather than report, so I'm not sure if that would help clarify it. It's really like what you, as you just described.
It is asking for, if we were to implement it, what would the transition plan be? Nothing in the bill tells you you have to do it. We're asking you for, hey, we'd like a plan on how to implement this moderate needs. How much would it cost? What would the staffing needs be? And what would the technical needs be? And what would the timeline be? That's exactly what we're asking for. So if it were to be implemented, how would we do it? Because what I heard when we were drafting the bill was exactly what you're saying right now. This is complicated. So we want to know what the complications are. And so that's why I'm sort of opposing it when what we're asking for is what exactly what you're telling us is complicated or what we want to know. So that's one thing. And then I wanted to ask you, you mentioned, Leslie, that the federal government uses the moderate needs budget and other things for the military. How does that work?
Let me just pull up. I probably am not, I'm definitely not the expert on this, but from the USDA website. Let me follow up with you on that as well. It might be for benefits for military personnel. I'm guessing. I don't remember.
Okay.
Back the top, but I'm happy to follow up.
Yeah, because I think the thrifty program, as it's named, is extremely thrifty. I mean, the lowest benefit that many Vermonters get is $23 a month to buy food. And I don't know if you've ever tried to buy food for $23 a month or ever done the sort of 3 Squares Vermont challenge where you try to challenge yourself to.
Is it a week or a month?
It's a week.
Yeah.
Yeah, well, no, the $23 is a month.
Yes.
It's $23 a month. But if you try to do the 3 Squares Vermont challenge, I don't know if you've ever done it. I have with my family. And it is really, really hard to live on that amount of money. And so I think I think it's telling that the federal government uses the moderate needs plan for military families. And that's great. And I think that all Vermonters and Americans should be able to get a higher level of the food benefits in order to be able to survive with their families. Or the $23 a month is often a lot of senior citizens in Vermont that are not able to fully feed themselves because they only get $23 a month. We end up putting a lot of money into charitable funding, like the food bank and Meals on Wheels and things like that to supplement people, but that's an expensive way to do it as well. And if people had access to the direct benefits, we wouldn't need to be funding these charitable programs. And so I think the cost benefit is really it's a better way to fund people having healthy nutritional meals. And at the very least, I would really ask you to say, we are game for doing this report because it will tell us the information that we need to know as to whether this is a feasible thing to do for the state. That's exactly what we're asking to do in this bill.
Thank you. Okay. I think there was a question in there about whether or not we would see this as a report. It says transition plan, but it is reported. Would you see that section as a report?
I think making sure that it's clarified that it's the report that you want would be, most helpful.
Okay. So Senator Weeks, then Senator Williams, and then me.
Just a curiosity question. So we didn't really receive a lot of testimony on the SNAP program, the details of the SNAP program in relation to this, how it jumps, but
You mean the mechanical?
mechanics,
Yeah.
yeah. So I'm curious, the $23 per month, which was Senator Corey just articulated, is that at a particular federal poverty index level, as opposed to, I'm sure there are folks who are receiving more than $23 per month. I mean, how is that to jump in at 23? No, certainly that sounds quite low, but where in the scale is that benefit? Is that, and I don't want to put you on the spot. It's just,
You asking me?
well, I'm just
I mean,
curious.
I think probably Leslie's more of an expert, but that's the minimum benefit for a single person for, but go ahead if you want to explain.
The federal government looks at the 50 food plan regularly, and that it is set October to September is federal fiscal year. So the most recent minimum benefit is 23. Last year was
But the minimum
21.
benefit, what's that based on? Is it based on a federal poverty index level or is it?
I don't know.
Okay, that's the clarity. And this is very little obtuse way to approach this discussion, not really knowing if it's $23 or if it's, you know, what the justification is to jump up to a moderate level and impact state treasury. It's
Well,
just
that's
a
what
little-
the bill is asking
That's what
for.
the bill's asking.
A
for.
report, a plan for
Right.
if we were to do it, how much would it cost
get it.
and what would it entail?
So I'm gonna, let's keep going with questions and then we'll get to discussion because this is a good discussion. So Senator Williams.
Just a clarifying statement is that you said that, that's good for military families. It's not. It's not good because having had military families under my control, they have to take from the soldier and the sailor's pay to supplement their food costs. So I just want to make everybody aware that $23 a day isn't good for anybody. For a week or a month isn't.
Well, absolutely, but it sounds like that potentially military families are getting the moderate needs plan, which is what we're asking for the report for that month, which is more than the $23 and probably still not sufficient.
So, okay, so we're looking at, we've been looking at the report section and it might be helpful to hear your, I know you gave us testimony in February on this bill and now are getting additional testimony. But there are also sections here. The first two sections really relate to participating in SNAP restaurant meals program. And so let's talk about that piece. Can we hear your comments about that? Even though it may feel redundant to you, it's helpful for us. The more you hear things, the more you understand. So with a navigator position in section 3. So maybe you could talk about what that would mean in terms of getting a restaurant meals program going.
So go through each section.
So your comments on the first sections, because you commented on the
Yeah.
transition.
So section 1, as I understand, when Keegan McGlynn testified, was that rather than saying the state may participate in the SNAP program, if you're going to establish a restaurant meals program, that would be awkward language. So proposing to change this section to the state shall participate in SNAP. So that it makes more sense that the state also has a restaurant meals program under the SNAP umbrella. I think we likely support the mandate that the state participates in SNAP, but it is an important safety net program for Vermont. The restaurant meals program, though I did testify back earlier this winter that the restaurant meals program is really helpful in states that don't have the ability to offer SNAP benefits as cash. So we're one of just a handful of states that can actually give the SNAP benefit and directly deposited into a household's checking account or savings account. Or we can send a check if they prefer, or we can give them an EBT card, but it's actually loaded onto the card as cash. So you could use it anywhere. You could get cash out of an ATM and then use that cash to purchase your groceries, or you could go to a restaurant with that. So the restaurant meals program is intended to benefit households with elderly household members, disabled, or those experiencing homelessness. Those households don't have access to prepare and store food, so that's the purpose of the restaurant meals program. The cash out program does a lot of what the restaurant meals program is intended to do, because the cash out program is limited to households with elderly or disabled household members. So half of Vermont's SNAP caseload is on the cash out right now.
For clarity, because you have a lot of words. So the target group that the restaurant benefit enhancement was initiated for are already covered with the cash deposits or not covered with the cash deposits?
It's a separate program. It's a state option that the state can elect to offer.
Right, but we are offering.
So you would, a participating household who met the criteria of at least 60, elderly, 60, living with a disability or experiencing homelessness, their EBT card would be specially coded already, and then the participating restaurants would have a point of sale machine that accepts EBT cards. So when they swipe their card, they know they can purchase the restaurant meals.
Right.
Thank you. I just want to clarify, because I think what you're asking is, does what Vermont do already cover what the restaurant program would do? And the answer is not really, no. Especially for all of the participants. So as Leslie has explained, we are a cash program for many Vermonters but you have to be 65 or older or disabled to get the cash benefit. So for the restaurant program, it's 60 and older. So there's 60 to 65 would be able to get the restaurant program. And also people experiencing homelessness. So those people right now are not getting the cash benefit and would be able to participate in the restaurant program. And I think that we got some testimony that it's quite a few people, can't remember 20, we can get testimony on, I don't want to say the wrong number, but tens of thousands of people would benefit from the restaurant program that are not currently benefiting from the cash program. Right now, the cash program is for disabled people and seniors over age 65 who qualify for SNAP.
Yeah, okay, so go ahead, Leslie.
I was able to get the number of households experiencing homelessness that don't qualify for cash out. That number of households was 2,604. I don't know the number of households between ages of 60 and 65. That would be a smaller number than this. I'm guessing. I can see if that is data that's available in our system. I'm not sure.
Yeah, I think that the Hunger Free Vermont has that data.
Yeah, I'm hoping that when Teddy comes up, that I'm also waiting for that. But so the overall, if we went forward with the section on the restaurant program, there is recommendation for a navigator to help restaurants and folks access the program. That's in section. And so maybe you could just.
I definitely think we could not do this work without an additional position. happy for you to add another comment.
Yeah, I think, it's correct. Any additional work that's newly already, I would say our Three Spurs program has a lot of programs, in it and has not necessarily, had the same growth to support that work. With a lot of federal reporting that also comes with that. We also are trying to make sure that we get summer EBT stood up, which is also a large body of work. So just we will need an navigator position because I also don't believe that we work with restaurants. I know the Grocers Association, is somebody that we engage with. But this would be a new body of work.
Okay, thank you. Any other questions for Miranda or Leslie? I appreciate your time, and we do have your previous testimony. And if you can get us the data that you were, earlier testimony, that would be very helpful. And then comments on the bill as a whole. So you commented on the need for position in order to make this work. Okay, and we did hear testimony earlier in the week about one individual's boss, Hayden DeBoy, and I don't know if you're familiar with him, who suggested some numbers to go along with transition plan that's there. I think he said something like $53 million, but I don't know if that's accurate or not. So we were hoping that you would look at that testimony and comment on that. Good. But so obviously it's Friday and this is crossover day. So we'll be, after we hear from Hunger Free Vermont, then we'll have a discussion, make a decision about it. Appreciate it.
Thank you for the time today.
Well, we could always ask joint fiscal office.
That's what the bill asks them to do.
No, it's sitting right behind you. Okay, okay, so let's see. Yes. Hunger Free Vermont. Thank you.
Good morning, everyone. For the record, my name is Ted Wozniak. I am the legislative policy lead with Hunger Free Vermont. And it's not typically my style to just sit and read. We've submitted the memo electronically, but there were a lot of questions asked that I think are addressed here, so I'm just going to go ahead and read through. I'm happy to take any questions. So in this memo, Hunger Free Vermont seeks to provide clarification regarding the provisions of S215 and to address several questions related to the SNAP restaurant meals program and to the changes to the Three Spurs Vermont minimum benefit amounts that have been raised by members of the committee during recent hearings on S215. So first off, S215 directs the Agency of Human Services to design a SNAP restaurant meals program that aligns with Vermont values. Under the federal SNAP restaurant meals program rules, states may develop their own eligibility criteria for participating restaurants. So in other words, the state has unilateral authority over which restaurants will not participate in this program. S215 would direct the Agency of Human Services and the Agency of Commerce and Community Development to work together to develop these eligibility criteria, which would require that the eligibility criteria advance these following goals: having locally produced food to be widely available in Vermont's RMP, including restaurants that serve food representing diverse cultural traditions, and ensuring geographic diversity of participating restaurants, so to ensure that those eligible are able to use the RMP in their nearby communities. S215 ensures that local Vermont restaurants, food trucks, and delis will be prioritized for participation in the SNAP restaurant program by creating a navigator position to provide technical assistance and support. Hunger Free Vermont has conducted interviews with multiple states that have implemented the SNAP restaurant program. And the key thing that all of them told us was if the state wants a variety of restaurants to participate, it's essential to provide the technical assistance for restaurants to apply to the federal government to get the needed point of sale equipment. While in states like Arizona and Rhode Island have implemented the SNAP restaurant meals program without hiring a navigator, national chain restaurants predominate those programs. In states like Massachusetts, they show that when technical assistance and support through the application process is provided, the program can operate effectively and efficiently for both SNAP participants and restaurants. The Massachusetts restaurant meals program has prioritized restaurants and food trucks that are locally and women-owned and/or minority business owners, and that serve a wide range of cultural cuisines. And when I was doing my homework for this hearing, I looked at the Massachusetts website. I found Brothers Deli in Lynn, Massachusetts, which just happens to be my favorite deli in Vermont. That was a difficult help for me. But on the next part of the bill, the cash out option. The cash out option is only available to certain Three Squares Vermont households. For most participants, monthly Three Squares Vermont benefits are issued on an EBT card. For an extremely select group of participants, monthly benefits are issued as a cash out benefit. This option is only available when all members of the Three Squares Vermont household are 65 or older and or receive SSI. Most cash out households are people with households of only one person. Around 17,000 people who participate in Three Squares Vermont receive a cash out benefit, which is roughly 25% of the total number of Three Squares Vermont participants. The cash out option is not available for the thousands of Three Squares Vermont participants who would be eligible for the restaurant meals program. This includes most of the 3,300 people who are unhoused who do not have permanent housing, participants who are between the ages of 60 and 65, participants who are the spouses of people who qualify for the restaurant meal program eligibility, and people who are disabled but don't qualify for a cash out benefit. And that's the difference between SSI and SSDI. SSI recipients are eligible for the cash out benefit, but SSDI recipients are not. The only state cost associated with implementing the restaurant meals program is funding for the NAPWI position. This is a common sense option for Vermont to adopt, especially with an aging population of Vermonters at risk of social isolation and a population of unhoused community members who cannot store food or cook meals of their own. Finally, S215 directs DCF to write a transition plan, and for the record, we define with report instead of transition plan, focusing on a specific segment of Three Squares Vermont households that receive such low monthly benefits that they do not serve to mitigate their food security. For many participants, the Three Squares Vermont benefits they receive each month is their entire grocery budget, though the program is designed to be a supplement for a monthly grocery budget. The federal calculation of a minimum benefit, which is only guaranteed for household sizes of 1 and 2, is based off of 8% of the food paying cost, which results in a monthly benefit of $23. And we've cited the statute there, and we worked with Senator Sanders' team to find out how that federal program is designed. We learned that the federal minimum benefit is calculated as 8% of the thrifty food plan. Whatever 8% of the thrifty food plan is that year becomes the minimum benefit. This is not a meaningful supplement to monthly grocery budgets for anybody. And households of 3 or more may receive a benefit as low as $1 a month. Offering a state-funded minimum benefit based on 30% of the moderate cost food plan would be a meaningful supplement to the grocery budget of eligible participants. This plan would impact a limited number of participants who receive very low monthly benefit. These are people who are not receiving a meaningful grocery supplement, including older adults and working families with children. We estimate that of the 40,000 households enrolled in Three Squares Vermont, approximately 7,500 households would be affected by this proposal, representing around 7,600 people. Based on Hunger Free Vermont's preliminary calculations, raising these 7,500 households to 30% of the USDA moderate cost food plan, which would represent around $100 a month, depending on the number of people in the household, would cost around $4 to $6 million annually. The purpose of the transition plan or report proposed in S215 would be to gain the data the legislature would need to make an informed policy choice regarding how to improve food security for older Vermonters, people with disability, and people who are unhoused. 8 states have already enacted a state supplemented minimum benefit or have active legislation to do so, and each state has their own methodology for determining the state supplement. So while the methodology outlined in S215 for DCF to explore is unique, the concept of the state supplanted minimum benefit is by no means unique to Vermont. It is important to underscore that the aspects of S215 focused on the state supplemented minimum benefit is a no-cost proposal because it simply directs the Department for Children and Families to produce a transition plan or report, which is crucial to getting an accurate and data-confirmed cost estimate. Using 30% of USDA's moderate cost food plan as a state minimum benefit level for Three Squares households would make the lowest Three Squares benefit a meaningful supplement that would actually help eligible households meet their monthly food needs. Vermont's Joint Fiscal Office has used USDA's moderate cost food plan as the basis for calculating the food portion of a Vermont basic needs budget since 2007. Aligning state administrative benefit programs with the accepted methodology for calculating what people need to meet their basic needs in our state just makes sense. USDA's moderate cost food plan for a single adult household is $352.40 per month. 30% would yield a minimum 3 Squares Vermont.
Can you say that? You're going pretty fast. Can you say that last bit?
Yeah, you're gonna have to slow down.
We
because
have to absorb
It's
it.
going out.
The average cost was the one that.
I've received that feedback. USDA's moderate cost food plan for a single adult household is $352.40 per month. 30% of that would yield a minimum 3 squares Vermont monthly food benefit for a single adult of $105.72. That's the end.
It's on the website.
We have it, we have it.
Yes, we have something ready.
So, why don't you ask your questions
So that
first?
was the question.
Okay, all right, okay, that's good. Questions?
That was that question. It's a good question.
So it's a problem child. Okay.
Now I'm wounded. Very sensitive. How many states are the moderate, utilizing the moderate plan now as opposed to the then plan?
For other benefits, I'm not sure. For calculating the minimum benefit, no. So that's the part of this bill that is unique, is having an algorithm or a formula to determine. Other states have done $100 because $100 is an easy amount of, it's a nice round number, it makes sense, and it feels like it's planted. Other states have done $55. There's one state that was at $97 because they're trying to fit it within their budget. So we're proposing the 30% moderate cost food plan because it aligns with the Vermont basic needs budget and it tracks that way.
Good, thank you.
Other questions? And I did, if you go to. It was, give me a second. We did have testimony from Opportunity Solutions Project, Hayden DeVoy. Kiki, remind me what day, I just looked it up today. Oh, here it was March 13th. Yeah, which has a different set of numbers, but may possibly calculate different from what you're doing it. So overall, can you help us understand within the bill, the restaurant navigator would help folks choose and find available more nutritious foods than they might find in a fast food environment.
Yes, this navigates, yep.
And then make the restaurant program available to more people within the ages of,
60 to 65.
okay, so we've expanded that, so there's a band of people there. It's growing every day. Yes, you know that, more than people. And then the second part of the bill, a transition plan that would be consistent with what we have been doing theoretically with our basic needs.
That's
All right, so then that would affect people on reach up or.
I can't speak to reach
Can't
out,
speak to reach up.
but essentially it raises the floor
Yeah, all
for fixed restaurant benefits.
right. First, I'm turning Leslie, I'll go back to you.
Most our reach out participants receive 3 squares.
Most reach up
Yes,
are what?
receive 3 squares per month.
Thank you, Madam Chair. I just want to clarify that the navigator position wouldn't work with individual recipients of SNAP. It would work with restaurants
restaurants.
to try to get
Right.
enrolled and help them navigate the program. Because my understanding is that the federal requirements are a little complicated for small restaurants to deal with. So in order for, what's your favorite deli?
Brothers Deli in Lynn, Massachusetts, if
Brothers.
anybody wants a field trip.
I would love a field trip there. Brothers Deli probably needed help.
Let's do one in
because they're
Vermont.
small.
Spend our money in Vermont.
Sure, I would love a field trip anywhere to a deli. Anyway, so that's what the navigator would
Yes.
help, so that there would be a more diverse restaurant selection. It wouldn't just be the chains. It would be, our local restaurants owned by Vermonters.
And I can think that maybe there are restaurants within this, program, you might offer special meals for folks with, who are utilizing the program. So
Yes,
that's what I was thinking of that working with a restaurant so that the price comes down, and, or especially if you're gonna have a special.
and it's one of our citations, the average price of a Massachusetts restaurant meal program meal is $11.
The individual.
For one individual meal from one of these restaurants for exactly the
Yeah.
one share.
For the reason. That's all. Okay. Okay, I did send, to both Leslie and Miranda, who's not here anymore. I had Kiki send off that report. We're obviously gonna be acting on the bill today, but going forward, it would be helpful to see how that report fits with what we're hearing from, you and from Hunger Free Vermont. I mean, I don't know what the accuracy of that is, or they do have reference. He does have a reference for each of his, ones. Go ahead.
I think it will be difficult to give you a number, which is why there's a report in the bill, but I will just say that if there was a minimum floor, it would affect more than those. It would affect more people than just those who are receiving $23 or $0. It would affect anyone receiving less than the floor. So that's,
That's hard to manage, right? or-
Well,
yeah,
it would just take, I think it would actually require a report to get to the actual number. But
okay.
that, there's some of the difference between the two numbers, but the rest of it, I can't speak to that for some.
So right now it says 30%. Is there any value in having a range so that we would see what would happen at different levels? Just looking around the committee. So 30% really fixes it. A certain number.
We believe the 30% makes sense
Okay.
in terms of both the basic needs budget, but also rather than, $100 now is not worth what it was 20 years ago. So if the
Okay.
committee were to fix it at $100 specifically, we need to update the legislation further down the road. Whereas 30% of the moderate food fund, as the federal government updates their algorithms, so too will have to be updated.
So we heard from, Mr. Boyce.
Yeah.
That, should be eligible for fast food places.
So that is the part of the bill, that states may develop their own eligibility criteria for participating restaurants. So if the state of Vermont wants to say that fast food chains are not eligible for the restaurant meal program in Vermont, we have the unilateral authority to do so. And that speaks to the importance of the navigator position as well, because the states that don't have the navigator position and leave it up to restaurants to go through the rigmarole by themselves, those larger corporations like McDonald's can just hire a lawyer to do all the work for Vermont McDonald's. Whereas if you go to Ellen Berry, so if you go to the Cornerstone Pub and Berry, they don't have a bunch of lawyers on staff that can help them navigate the process. But those are the restaurants that we want to encourage folks to go to. And so the navigator position helps them keep up with the bigger chains.
Okay,
Thank you.
thank you. Any other questions? All right, good. So we've just heard a lot to put in our brains, and we have thought about this bill earlier. So what I'm gonna suggest now is we move on to the next bill, and we'll come back to this. Thanks. We'll come back to this to consider it.
Today,
Yeah,
okay.
we'll do it tomorrow.
Thank you.
Yes.
Yes, okay.
Okay. All right, good. That's good. Let's go on to, and Leslie, thank you so much for being available at short notice.
Absolutely, anytime.
Yeah, I appreciate it. So, and obviously we will come back to the bill. I can't promise you what time it'll be, but we're coming back to it today. And see how it goes. But, just for me, I think having the restaurant program available to as many people as we can have it available is so really important. And, it's the money that's in there, that's problematic. But, if it's going to advantage people and cause, healthy Vermonters and prevention of chronic illnesses, we can get them better, more food, then it makes, makes sense. So that's the way I'm looking at this. And I have no idea what would happen should the bill go down the whole way. I do have an idea. Okay. All right. Um. 231. Katie, we don't have anything new on this bill, do we?
You do not, you have the same amendment that
I
I looked at.
can look at it one more time, it's like, yeah.
Morning. Good morning. Katie McGlynn, Office of Legislative Counsel. So here's the amendment we looked at yesterday, just to refresh your memory, this is the community nurse programs. We said the amendment we looked at yesterday was on or before November 1st of this year. AHS, in collaboration with the Vermont League of Cities and Towns and Community Nurse Partner Programs, shall submit a fiscal recommendation to the Appropriations and Policy Committees, proposing a fiscal mechanism by which municipalities seeking to partner with a local community nurse partnership program may pledge municipal funds to draw down a state match for the program's operation. The effective date is July 1, 2024.
Okay, discussion, let's go.
Just
Yeah.
for clarity, so that's it, that's the bill. This isn't an amendment to something. This is the
This
current
is the bill,
status.
this is a strike all amendment, so this is all that's left, yeah.
Um. Discussion. I mean, I did get an email, I don't know how broadly it was sent, I was copied on an email from some of the folks who are interested in doing this, and their comment was, well, maybe we should just work to see if we can get funding from, social services, municipal social services funds. If they can do that individually, that's what's happening now. So it just seems like this is a better fit with, either regional or municipal support. It does fill a gap, no question it fills a gap. I'm not sure that, I think we need more information, probably more time, we have a choice of moving it forward and allowing for additional information and thoughts in the house. Or we not move it forward, so. Yeah,
I think this is a great program. I never have been fully understand how it fits with other home health programs. That's the thing that I never. And I missed some of the testimony, so it's possible that question was answered.
yeah, it was, but it does fill a gap, but you're right.
Yeah, I mean, I think it's a great program and it's clearly needed in a lot of communities, so I think this is a fine option to sort of keep it all on the table and see if we can work it out, but even though I'm frustrated by more reports, but I'm fine with it.
Another report. Okay, well, but, yeah, no. Senator Gullik, any comments or?
My only comment is I think it's such a great program. I also feel, I'm not in the money committee, so my knowledge of the bottom line is limited, but my sense is that there are a lot of things that we want to do this year that we can't do because we are in financial dire straits. And that's just I'm an outsider. I'm not in, like I said, I don't have all the information on what's
Yeah.
happening financially, but it's a shame. I feel like in a way we're kind of
No, I don't think we're letting them down. I think that the issue is we do have home health agencies. And we have folks who are, cared for, who are lower income. And so they receive the benefit. There's a little gap place in there where people have a higher income and they're not eligible for some of the home health services. And they need it, and it's very costly to them. And there are local nurses who can provide that support. So that fills that gap in. The question becomes then, does the state fund everybody? Or is it held to a specific income level? And so we're trying to fill the gap without, I forget how much was in the original bill, 450?
450.
Yeah, $450,000. That then the concern was that we're paying people who can already afford it.
Right, no, I understand
It's a
that.
big.
Yeah, and I don't know if our municipalities have the wherewithal to be funded.
Well, we did hear from some, and there are some who do that, whether it's a local program or whether VLCT can reach out to regional planning commissions, maybe there's something there. Don't know. I know it would have a very difficult time getting out of appropriations, if at all. So this is the next best possible.
That's up to appropriations.
You want to pass $450,000?
Conceptually, we could, for what the amendment is, we could pass it on here.
Right.
But we're still seeing, you have to do study.
Yeah, no, what would happen if we pass this, it'll go down the hall because of the underlying bill. And then, probably would come back out on the floor. So,
I'm fine, I move that we find favorably draft 1.1 of S-231. I'll second.
okay, any further discussion?
Okay, I'll start with me this time. Senator Bueller? Yes. Senator Hardy?
Yes.
Senator Williams?
Yeah.
Senator Vice Chair Weeks?
Yes.
Chair Lyons?
Yes,
5-0.
would like to report.
I would like to report S-215 when we vote that.
Okay. Do I have a reporter for,
I mean, I can do it if no one else wants to, but
you have 114?
I do.
Remember that.
I do, I know, so I'd rather not.
Williams. Yeah.
There we
All right.
go.
Thank you. That's terrific. Okay,
Volunteering you.
let's,
Yeah.
all right, that's good. Tell me when you would like to look at 215. I'm open to that, viewpoint. But, while we have Katie here,
I would like, another committee is expecting.
another committee is expected.
But can you come back, Katie, or can we just get it quickly?
We can probably do it without you unless we decide to make an amendment.
It's up to you,
Yeah.
I'll be in human services, so if Kiki wants to
Okay.
email Lori Morse when
Okay.
when you need me.
All right, let's hold on. So let's move on to S98 and thank you, Jen, for being here.
Good morning.
Good morning.
Jennifer Carter from Office of Legislative Council. Do you want me to put, I have not made any changes since the draft we looked at yesterday of S98.
Let's put it up
Do you want me to put
anyway.
it up? S98, an act relating to Green Mountain Care Board authority over prescription drug costs. And so we looked at yesterday, the bill directs the Green Mountain Care Board, consultation with others, to explore and create framework and methodology for implementing a program to regulate the cost of prescription drugs for Vermont consumers and Vermont's healthcare system. It gives them certain things to look at, looking at experiences of other states that have developed prescription drug affordability boards, the development and operation of the Medicare drug price negotiation program, other promising federal and state strategies for lowering prescription drug costs, the board's existing authority to set rates, adopt rules, and establish technical advisory groups, the likely return on investment of the most promising program options, and the impact of implementing this program on other state agencies and on the private sector. Changes we looked at yesterday would have more information coming to you in January. So not just an update, but the board's preliminary plan for implementing a program to regulate the cost of prescription drugs in Vermont, and any proposals for legislative action that they find is needed to implement the program. And then by January of 2026, the board would provide its final plan along with any additional needs they've identified for legislation. Creates 2 positions at the board, Director of Prescription Drug Pricing and a Policy Analyst. Appropriates $245,000 from the to the Green Mountain Care Board from the Evidence-Based Education and Advertising Fund in FY25 for those positions. Gives the board legal assistance as needed from the Office of the Attorney General, and appropriates $250,000 from the Evidence-Based Education and Advertising Fund for contracts with experts on prescription drug related issues. Sections 2 and 3 make the Green Mountain Care Board's use of funds from the Evidence-Based Education and Advertising Fund an approved use for prescription drug cost regulation initiatives. So that's in both sections for the fee and for the fund itself, and capping the amount that can be used in any one fiscal year from the fund at $1 million to support the board's prescription drug cost regulation initiatives. And the act will take effect on July 1st.
Okay, discussion committee.
All for, we need to lower costs.
Okay. Need a motion?
Take out the highlighting.
I will move, version
Can I get 3.2?
3.2
The clean
of
version.
S98
As amended.
as amended favorably. As amended.
I will just say one thing, for discussion, which is Jeff Hochberg, who we've had in for testimony, earlier, and who has some knowledge of, he's a retailer from Rutland, who's done a lot of work on this area. Did send out an email. Did we all get that email? I know that I just copied on it. I think it went to you, Senator Weeks. Maybe we should share that around, but, he had, do you want to say anything about it?
That was like, 300 issues ago. I don't recall what.
It was the email about ROI,
Yeah.
return on investment.
Yeah, I remember that was a topic, but I didn't.
Okay, well, if you wish to have it put on the webpage, I think that'll be okay, but I will do it as a copy. Okay, so there's a motion.
Second. Senator Gulick, yes. Senator Hardy, yes. Senator Williams.
No.
Vice Chair Weeks. And Chair Lyons,
Yes.
3-2-0.
I'm happy to report it, the ratings, support from the team. This is a tough topic, but it's an important topic. I mean, saving money for prescription drugs. Glad that the board will be able to bring us information, to maybe understand what we can do and what we. Okay, and
Alright,
we'll go
just
down
send
the
you
hall.
the, yep, just sent you and Katie the
Okay,
final version.
thank you. All right. So we're on to, we're having. 263. International medical schools.
Oh,
So, what, is there anything new in this bill?
There is not, you have not requested any changes since the bill was introduced.
Not sure this one's ready for prime time.
Yeah,
yeah,
It's like we haven't had chance to sort of work through the issues.
yeah, and if you don't have the Board of Medical Practice,
Yeah.
that's slow. So, what do we think? I'm not interested in voting on the bill, but I just
I
want
think
to,
it's a phenomenal concept,
yeah,
trying to solve a problem.
Yeah.
In this case, we're directing it towards a group that already has expressed a great deal of hesitation. And I don't think that's, given this is the ninth hour of the ninth day, I think we should keep this for the next future session.
yes, and I have talked with the people who introduced the bill, and then some of the people, I haven't talked with them directly, but the senators have been in contact with the folks who are very passionate about this. Oh, my suggestion to them was, maybe there's an opportunity if there's a conversation with the director of residency programs at UVM, because that's where we have the residency programs. Maybe there's a way to do something, but we can't do that. We can't do that. That's just one thought, maybe others. I agree with you, somebody.
I agree with some.
Okay, so that one's over. And and I've already talked a little bit with the main sponsor that we've had.
Who was it?
Senator Harrison.
That's 250.
Yes. Let's go back to 215, that's what we have. Katie is not here and that's okay, but Jen, is there anything else that we need to know?
Sent through you.
And I have Nolan, you've given us the fiscal note related to the fund,
Yeah, I'll get this one from Bill.
please, yeah. And, I'm just thinking, I don't think there's any 98. I don't think there's any other things. Okay,
Well, there would be one for 215 or 512 or whatever this.
yeah, so 215 is the next one. Don't go away.
All right, you are done with me.
Oh. Oh, wow.
I don't know.
215, but it's not Jen's bill, it's Katie's.
I know it's Katie's bill,
So I would move as 215 as introduced. I think that it's gotta stop down the hall anyway, and especially since we don't have Katie here, I mean, it's just. I think that is, the transition plan is a report, we made that clear. I don't know that changing the word makes any difference. And so I would ask 215 as introduced.
okay, that's a motion, a discussion,
Yeah, I'd like to discuss it a little bit more. I just have to harken back to what I said before around the financial quote unquote dire straits that we seem to be in. And I'm in a couple of committees, so I'm advocating for a whole bunch of different things, and for me personally, I'm not sure that the navigator position is realistic. So, I mean, to Senator Hardy's point, I'm happy, if you wanna move it down the hall, that's fine, but
here's my thinking on that, here's how I move it down the hall. Cause it will be down there for a while, or it could come out with navigator position on. We're gonna be looking at, sections of the budget that relate to our jurisdiction. From the, once the House gets a little bit more, closure. And we'll invite joint fiscal to come in and go through those sections of the budget with us. And then we can advocate for our priorities. And it's at that time we can decide where this fits with our priorities. I will vote for that, for this bill on that condition that we understand that we'll do that. And then that'll do two things. It helps us, but it also helps appropriations. That they can't make decisions about all of the things that every committee is coming in until they look at all the priorities. So I think sending it down the hall with the navigator position at this time is a bad thing to do. It's not a massive amount of money. And it also will allow for us to integrate that into our broader budget discussion. We're not gonna spend days on the budget, but we are gonna look at what priorities we might want to list. So that's the way I think about this.
I mean, I am in favor of the study. I think that's a good,
Sure,
yeah, understand.
The appropriations committee will just take the position out and the money out, because that's what they're doing to everything at this point, so.
they will, and but if we say where we wanna evaluate this and keep it in as part, maybe keep it in, or where it's listed in our priorities,
Yeah,
then they might not just take it out automatically, or they might say, okay, we'll listen to you later on.
Yeah.
So, yeah,
no, I think yours is a good plan.
okay, let's,
What draft is this? Is this
Just still as introduced.
as introduced?
yes,
I
no
just,
line
for
though.
the record, only I went to fiscal, I talked to Miranda. And she said they couldn't do that restaurant piece without the position. So if they strip the position, they're probably gonna strip the whole,
Whole section,
I just want to make sure.
yeah, thank you, we got it. And we'll have a fiscal note with this.
Okay, yeah, absolutely.
Okay. All right. Any further discussion? This is difficult, I understand, we don't know the implications, but that's why we were asking for the implications, if, you know, it could be that navigator position lasts 1 year, we don't know. Be a single year or 2 years, or whatever, for fitting up. All right,
Senator Hewitt, yes. Senator Hardy,
Yes.
Senator Williams,
No.
Vice Chair Weeks.
No.
Senator Lyons.
yes,
Oh, we were two, okay, 0. Order. That's order.
boy. Anything else you'd like to do today? Not gonna keep skiing. I think we're at a wrap. So